Hypertension ICD 10 coding guidelines. In that, if the only hypertension is documented, then only we code I10. If a hypertension with heart disease, we code I11 series. If hypertension with CKD, we code I12 series. And if hypertension with heart disease plus CKD, we code I13 series. One important coding tip here is condition coded with I51.4 to I51.7 and I51.8.9 and I51.9 are assumed related to hypertension. That means if hypertension documented with these conditions like myocarditis, myocardial degeneration, cardiomegaly, certain inflammation related heart condition. If these conditions documented with hypertension, we cannot code them separately. We need to combine them with the hypertension. If the patient has hypertension coded with this condition, uh, these code we can code additionally except myocardial degeneration and cardiomegaly not coded additionally with hypertension. Remember that if the condition coded I51.4, I51.9 are due to hypertension, they are included in I11 code category and should not code it separately. That is, see here in alpha index, when the hypertension with this condition we code I11.9 and with heart failure I11.0 we can code. Second, hypertensive crisis. What is meant by hypertensive crisis? When the patient's systolic blood pressure greater than 180 or diastolic pressure greater than 110 and it is unknown whether the organ damage has occurred. In the hypertensive emergency, likely to cause damage means organ damage not happen in hypertensive emergency that can result in organ damage and life-threatening complication. I16 code we can code for hypertension urgency emergency hypertensive crisis and code also any hypertensive disease that is I10 to I15 that sequencing based on the region of encounter. Then the secondary hypertension. Secondary hypertension that is hypertension caused by underlying medical condition must be code underlying condition first. Hypertension code comes from I15 category. That means here two code needed. First one underlying condition, then the I15 series secondary hypertension code. These are the some codes for secondary hypertension. I15.0 for the renovascular hypertension. That means when the narrowing or stenosis of the artery supply blood to the kidney. That condition first code should be stenosis of artery. That is I70 something code. Second, I15.1 hypertension secondary to other renal disorder like nephron diseases. And third, I15.2 that is hypertension secondary to endocrine diseases. If the hypertension causes certain endocrine disease like Cushing syndrome, primary aldosteronism, acromegaly, hypothyroidism, or another specified endocrine disorder, that time we can code this I15.2.